Many Democrats have already announced their candidacy for president in 2020, and most of them have announced their plans to create a Medicare-for-all plan as part of their candidacy. We're going to take a look at what it means to say Medicare for all. And it means different things to different people. Of the number of people that have announced their candidacy right now for president, there's a different variation of Medicare for all from each of them. To some, it just means a pure single-payer system or a public option. To others, it means a single-payer system that doesn't use any private insurance of any kind. And to others, they actually are talking more about Medicaid for all or a Medicaid buy-in program, nothing to do with Medicare. Most commonly, if you were to say Medicare for all, people would envision the concept of a generous single-payer system that could be extended just to cover more people across the United States. But to understand what that might look like, we have to have a little bit better grounding of Medicare 101. What does Medicare look like right now? So let's take a couple seconds to ground ourselves in Medicare. Medicare is a federal health insurance program. It's designed for people who are 65 years or older, some certain young people with disabling conditions, and people that have end-stage renal disease. There are generally three categories of Medicare-eligible individuals. And it's broken up into different types of plans. Now, you've heard Medicare Part A, which is the hospital coverage, and we're talking about coverage for inpatient hospital stays or stays in a skilled nursing facility. There's Medicare Part B, which is more of that medical insurance that covers certain doctor services, outpatient care, medical supplies. There's the very popular Medicare Part D, which is the prescription drug coverage, and there are Medicare medical savings account plans that then ride around the fringes of those as well. Now, there are things to know about Medicare that make it distinct from some of the proposals we're hearing from different candidates. It's not covering everything. It's designed for the senior citizen population largely, so it doesn't cover things like pregnancy, vision, or dental care. It wasn't designed for children and families the way that Medicaid was. It also includes copays and no limit on out-of-pocket spending, and that's why you see a lot of these supplemental plans that have popped up over the years as well to help cover some of those extra costs. And it largely relies on private insurance, especially for some of those Part D services and the Medicare Advantage plans. Now, the Medicare for all proposals, none of them envision just taking Medicare as it is right now and adding more people to it. That's not the plan at all because of those shortcomings we just talked about. But the concepts that people are talking about are the ones that are gaining traction, like public-private partnerships. You can have a federally run program that then uses private insurance companies to help deliver the coverage and identify the payer sources for that coverage. Larger risk pools. Health insurance works better when there's more people in it, and that's why growing the number of people in Medicare seems appealing. Add more people to it, especially younger, healthier people, and you can bring costs down and have systems of efficiency and streamline administration. You can have group purchasing power. That's one of the biggest advantages of Medicare is you have the whole power of the population of Medicare enrollees behind you when you're negotiating for lower costs and services and drug prices. More generous benefit packages. Again, if you have more people in an insurance plan and you can bring some of those costs down, you can then extend services and coverage to more benefits. And the efficiencies, again, like we mentioned, that come along with administering this size program. And then, of course, the things we watch for most of all, the consumer protections that come from that. When you have federal entitlements that extend to numbers of people, you have a better chance of making sure you can ensure the protections of those individuals to make sure that they can't be excluded for things like pre-existing conditions. That's just not a thing in the world of Medicare. So why now? Like we said, not only because it's popular, Medicare is popular with senior citizens. You hear them say all the time they don't want their Medicare taken away from them, but especially among the candidates for president in 2020. And we're talking about people like Senators Cory Booker, Bernie Sanders, Gillibrand, Warren, Brown, among others. Most of these senators have announced a Medicare for all proposal of some kind. And there are other bills, not just from candidates, from people actually in the legislature right now trying to put this in front of the president or at least in front of their colleagues to get a little traction. Now, Bernie Sanders was known for his Medicare for all legislation in the last session. In this session, we have a couple of senators and representatives that are pushing different types of Medicare for all bills. And we can see, again, just by looking at the slide, some of the variations. The first one coming out of the House of Representatives includes bundling everybody together, anybody who's uninsured, anybody who's on Medicaid, anybody that bought an Obamacare plan, and anybody in Medicare right now, cluster them together, let employers buy into it, and have one big, robust Medicare plan. That's their proposal. Senators Chris Murphy and Merkley have a Medicare-for-all option as part of the marketplace. You could buy an Obamacare plan that's going through a private qualified health insurance plan in the marketplace, or you could buy Medicare in that same shopping experience. Drastically different variations and ways that this could work. So what to listen for? Because we know there's so much variation that Medicare for all isn't a one-size-fits-all answer. When somebody is saying, I'm running for president, I want your vote, this is what my Medicare for all plan looks like, make sure you listen to the details and think about who does it cover? Who are they adding to that risk pool? Is it more young people? Is it people that could buy in as part of their job? Is it the Medicaid population that's getting merged in? So try to identify who the people are as part of that plan. Who are the payers? Does it use a private insurance, a public-private partnership? What benefits or services would be covered? Is it expanding to cover those services that the traditional Medicare wasn't envisioned as providing, like pregnancy coverage, like we mentioned? How is the risk being shared, and what are the cost savings? There are advantages to having bigger risk pools. How can that be passed along to the consumer in such a proposal coming from candidate X, Y, or Z? Now, we wanted to share a quick slide that tells you some of the thinking we've been doing just for our state of Wisconsin. We put these ideas together using those concepts of common sense health coverage expansion to promote consumer confidence, promote consumer choice, to build on quality and accountability in systems administration. And we propose building on Wisconsin's version of Badger Care Plus, which is now for childless adults, children, or families. Now, that system, we say, use what you've got in those strong public-private partnerships and the networks that are established right now. Add people to that, grow the risk pool. But we also say, and leave Medicare out of it. If you think that idea sounds intriguing, we're going to share the link below in the description where you can read what our proposal would look like. And we're just saying for the state of Wisconsin. And then you can envision what that might look like nationally. If you've got questions on what Medicare for all means or your thoughts on what this could look like in 2020, definitely send us an email or visit our website at healthwatchwisconsin.org.